This is Debbie Bucher with Parkland College, and this is for the LPN to RN Transitions course, and this is for Chapter 4 from the book by Laura Claywell, and is with regards to distinguishing the RN role from the LPN role. So you all have decided to take on a new and different role in nursing from your LPN role to now transitioning and changing to the RN role. While this is an exciting change, it also may bring about some uncertainty as you embark upon this journey. You will have a role transition that you will experience from an LPN to an RN, and it requires understanding of the major differences between the two roles. And some of these differences you may not even be aware of at this time, but by the end of this class and program, you will certainly know the differences between an LPN and an RN and what the expectations are for each role. And of course, we have many roles in our lives as nurses. We are not only nurses, LPN, RN, certified nursing assistant, CMA, wife or life of a mother, teacher, student, that you all are having student expectations during this time. So all these different roles have different expectations and different traits that go with them. And with each new role comes a set of different behaviors to help formulate your performance to meet society's expectations of you as an LPN and now as an RN. So this requires a change from one nursing role to another and involves a change in behavior. And of course, this change takes place over time. As an LPN, you all have acquired certain attributes that you have judged to be important as a nurse, such as a strong work ethic, ability to organize, efficiency, kindness, and dependability are all necessary traits to have. And as an RN, you're just going to be adding to these traits with a broader range of different qualities and traits and attributes. Again, it is a good idea, as you guys are all experiencing the same changes and transitioning into your new role, you all can be a source of support for one another, which I think is important. And it's important to have that sense of belonging and have that sense of support with others that you know that are going through the same thing as you. So it really is important that you are all a source of support for each other, but also that you're getting support from those around you at home and friends and family. So some difference between the LPN and RN roles. Um, as far as autonomy, the LPNs function at the guidance and direction of an RN or another care provider, whereas RNs function independently and and assessing and educating and health teaching and health promotion. As well as the educational level, as an RN, you may be learning more how how to do something versus why it is that you're doing something. And there's just, you're always, no matter what you're doing as an RN, you're always using your critical thinking skills to determine the best, action and plan and interventions for your patient. And yes, critical thinking is, you use critical thinking, of course, as an LPN, but you are expanding upon your critical thinking skills as an RN, and you're gathering all the facts related to the situation and assessing, using all your assessment abilities to make the best, to make the best decision and judgment for your patients. So your assessment skills, you need to have really good assessment skills. You already have good assessment skills as an LPN. You may even broaden your assessment skills as an RN. And of course, care planning. An LPN can give information to the RN. Although I do know that many of you are working in long-term care facilities and you do have, I think, more input into the plan of care for as an LPN, maybe as what you would if you worked as an LPN in the hospital. But as an RN, you'll be uh, coming up with that plan of care, including the assessment, nursing diagnoses, outcomes, planning, and interventions, as well as evaluation. So you're going to be gathering input from your healthcare providers as your LPN. Even your certified nursing assistant can give you data and give you information that you need in order to make the best plan of care that you can for the patients that you are caring for. And of course, you have different legal and leadership responsibilities, more leadership roles. As an RN, you may be a team leader, a charge nurse, a nurse manager, or you may even, want to be maybe eventually a nurse administrator. All those roles are RN roles and functions as part of a team, but that maybe have different actions and roles that you'll perform with each one of those. IV therapy, many of you are working at institutions maybe where you've been able to take a medication test that they will then allow you to do IV meds. Some of you may not, but some of you may. But as an RN, you're certainly going to be able to monitor, give IV medications and monitor them and assess as to whether they are helping your patient or not. So you do have an expanded role in medication and the use of medications, and of course, assessing and evaluating whether your patient is getting better with these medications. And of course, good communication skills. You're just expounding on your communication skills from an LPN to an RN, and you may pick up, because of your education and certainly in mental health nursing, you may pick up on different behavior that might affect your communication skills. And then, of course, patient teaching as an RN, we certainly are doing a lot of education. We as RNs are educated on theory and patient teaching and understanding communication and understanding therapeutic communication, which is very important, which you all are taking mental health nursing. Really, mental health nursing you use really in every area as a nurse that you will practice in. You use your mental health skills everywhere, not just on a mental health floor. You use them everywhere in all of the care you give to your patient. You are using your mental health skills. And education preparation. There's the one RN designation, but there's different routes that people may go with their education. You all are embarking in the associate degree program here at Parkland College, but there are also BSN programs and diploma programs, although there's maybe only 4 or 5 diploma programs in the United States. Actually, according to your book, there's less than 70 diploma programs in the U.S. I have a hard time believing there's 70. I think there's probably a lot less than that. So there's more and more ADN programs coming about. What's nice about the ADN program is you can get through it in, usually no more than 2 years. Although some people, that's the program is 2 years. Some people may take a little bit longer, of course, while they're getting their general education courses. But the nice thing about the ADN program is you can finish up your degree, get your ADN degree, and practice as an RN, and then you can do this while going back to school, be paid for working as an RN, and then going back to school to get your BSN, and then many of you may go on to get your master's in nursing. But of course, you can be paid, and many institutions will help you with your tuition. So I would really encourage all of you to be thinking about that as you go along in the program here, of what it is that you are maybe wanting to, different areas that you may be wanting to go into, and also to look at different programs that you may be interested in. There's many different BSN programs out there these days, and most of them you can do online, which is nice because you can do it kind of on your own time. And then after you get your BSN again, many of you may go on to get your master's, maybe nurse, maybe even be a nurse anesthetist, nurse practitioner, midwife, et cetera. But there's just so many different roles as an RN and many different educational programs that you can go into and become advanced nurses. So many more areas of specialization that you can be certified in. And it's the American Nurses Credentialing Center that does a lot of these certifications. And it's a subunit of the American Nurses Association. So as a nurse, if you become certified in certain areas such as med surg or infusion nursing, it just shows that you have a higher level of knowledge within that specialty, which can be very helpful. So I highly recommend that you maybe on down the road that you receive a certification in the area of nursing that you are practicing in, but also maybe thinking about belonging to one of the many professional organizations that as they help, provide education and socialization in nursing. And the American Nurses Association, their website is www.nursingworld.org. So I'd encourage you to take a look at that. And as we've talked about, there are differences in your practice from an LPN to an RN. And of course, there's just many different responsibilities of nurses depending on their educational preparation and licensure. And every state has a Nurse Practice Act, and so our scope of practice is defined by those different individual state nursing practice acts. So it is important that you take a look at this. There's also individual state boards of nursing, which are located within the government organizations at the state level. And of course, they have this to essentially to protect the consumers and making sure that nursing is being regulated, which is very important. So the NCSBN is the unifying body for state boards of nursing. So that's important. And of course, as an RN, we talked about the plan of care. It six standards of practice, your assessment, where you're assessing your patient, you're finding out more about what's going on, then you're coming up with your nursing diagnoses based upon the problems that your patient is experiencing, and then developing specific outcomes for your patients, and then planning your interventions, and then implementing your interventions. And then, of course, after you've implemented your interventions, you're evaluating your plan of care to see if indeed your plan of care is helping meet the patient with their outcomes. Very important, which we will be focusing on that a little bit more in later chapters. There are 11 standards of professional performance within the RN role, and your RN role is measured by these standards. And ethics is just right up there as one of the most important things that we need to follow is to have good ethics. As nurses, we need to critically analyze our actions and make sure that we're asking our questions of ourselves as what should I do in this situation? What's the right or wrong thing to do? And the nurse really needs to integrate ethical provisions in all areas of practice. We always want to help the patient meet the best outcomes that they can and make the best decisions so that we're not potentially causing harm to our patients. We certainly don't want that to occur. Culture is also something that we need to be aware of, and it's the ability to provide competent care to many different diverse cultures. It's important as you're taking care of patients with different cultures, you may want to do a search on the computer within different cultures and how they view healthcare practices, because that might come in play as you care for your patients. And it's important that we do recognize that there are many different cultures out there, and we want to make sure that we're providing the best competent care to our patients. Our communication is very important. It needs to be clear and precise, and we want to make sure that we're using therapeutic communication and that we're providing empathy, genuineness, and positive regard and self-awareness. We also want to collaborate with other members of the healthcare team as well as the patient and family. We want to make sure that we are providing that interprofessional care and overseeing so that we're making sure we're making the best decisions for our patients. As an RN, you will be looked upon, looked upon as a leader in your professional setting and the profession. And education, you never stop learning, and you always want to be looking at your professional development and making sure that you're staying on top of the most current practice and evidence-based practice to help our patients meet their best outcomes. And evidence-based practice, of course, is based upon research. So as a nurse, you want to take a look at the different practices and research findings into the best practice and integrate the best available practice and evidence that is currently out there, as well as you want to practice good clinical expertise, which of course helps us address healthcare questions and evaluate and making and finding different research and putting those into practice. Of course, we want to have good quality practice. We want to make sure that we're, again, following their standards and making sure that we're providing the best care we can to our patients while not harming them and helping them meet the best outcomes. And as a in professional practice, you always want to be evaluating yourself and making sure that your nursing practice is, the best within the profession, and you're abiding by standards and guidelines and rules and regulations. You want to be a good utilizer of the supplies and uh, different things that you are using to make sure that you're making the best decisions for your patients and making sure you're making. We never used to, we never used to have to worry about the cost or worry about supplies, but really as a nurse now, you really need to be looking at all facets within the patient. And part of that is making sure that we are using good resource utilization, not only for supplies and that, but like for the patient, but also making sure that we are providing leadership to our patients and to those that we are working with. And of course, environment is also important. We want to make sure that we have a good physical environment and making sure that we're maintaining a clean environment for our patients so that we can have good infection control. And a question here, which statement indicates that the nurse correctly understands the 11 standards of professional performance? One of the 11 standards is, and it's number 1, communication. And we talked about how important. Next is multi-state licensure. The Nursing Licensure Compact was developed by the National Council of State Boards. What this does, it allows nurses in compact states to work in other compact states without having to obtain a license in that state, which usually takes quite a while to do and of course can be costly too. So, but it's important because it allows nurses to quickly cross state borders and provide vital services in the event of a disaster. It also can help facilitate telenursing as well as online nursing education. And again, it makes practicing in these compact states, crossing the borders, again, it makes it more convenient as well as more affordable. And it helps with the nursing shortage if there's nursing shortage. Of course, there's nursing shortages all over the place, but it helps, makes it a little bit easier for nurses to go within different states that are in the compact states. So Florence Nightingale, she believed the role of nursing is to put the patient in the best possible condition for healing to take place. And of course, we want to protect, promote, and optimize health and abilities, prevent illness and prevent injury, and help to alleviate suffering through the diagnosis and treatment of human responses, and advocate for our patients, families, and communities, which is extremely important as a nurse that we do this. And there's three primary roles of an ADN nurse, and that is a provider of care. We provide care. We're a critical thinker. We're a teacher. We collaborate, and we're a patient advocate. We also want to try to be as culturally competent as what we can be. The RN will prioritize care, manage care, delegate care, makes decisions, practices within legal ramifications, and uses ethics, and works with all disciplines to provide the best care for the best outcomes. Manager of care, the RN manages and prioritizes the care, again is a delegator and decision maker, and practices within legal and ethical processes. And the RN is a role model and gives feedback to the different members of the team. And member of the profession, the RN will assume accountability and professionalism and responsible for their actions. They see the patient as a whole and works within the team. And the ANA founded 10 domains of nursing, which we will be looking at in the next slide here. So again, from the American Nursing Association, nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through an improved educational system that helps promote seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And we need to have an effective workforce for planning and policy making and also that require better data collection and information. And it really is imperative that we as nurses that we are clear on the expectations for the members of our profession and we find our unique role in helping to sustain it. And again, as an RN, we are the provider of care, we're manager of care, member of the profession, we advocate, we are policymakers, critical thinkers, teachers, communicators, leaders, and researchers. And nursing is affected by many different factors, as for instance, the advancement of information technology, our population is aging, nursing and nursing faculty shortages, government regulations, methods of healthcare delivery, and globalization. All these will affect the way nursing is practiced in the future. And it's our responsibility to become a lifelong learner and to stay informed and abreast of all the different changes in healthcare, which there are many changes in healthcare. So it's our job to make sure that we're staying on top of these things. So, well, this concludes the lecture portion for Chapter 4 in the LPN to RN transitions.